for a course of whole brain irradiation treatment. First few points I want to point out prior to starting is that this is a CT simulator. It's different in a diagnostic CT scan in that it has a carbon fiber table, which mimics the treatment table that the patient will be on during their course of their radiation treatment. And also in a minute when we show the software, it has a different type of software that mimics the radiation treatment machine. So the first thing that the patient will go through is what we call a CT simulation. The patient will be lying on this table and will also create some immobilization devices that will be used for the course of treatment. So in the case of whole brain irradiation, the immobilization devices that are made are this right here and the aquaplast mask. The aquaplast mask itself will start out in this shape. We will then put it in a heated temperature above 71 degrees Fahrenheit to make this aquaplast mask. We'll position the patient on the table as such, place the mask on the patient, and then the patient will go through the CT scanner in a motion such as this. Once the patient is CT, the physician will then come in and place on the isocenter. The isocenter is a three-point landing that they will use to localize for the treatment of the patient. For doing such thing, they'll use tape and any kind of marker. And then they'll put the marks on the aquaplast mask just as you see here. One at the top of the head. Point laterally both right and left. And then at times one on the chin, just to make sure the patient's head is very straight. The next step we will go to is the software. We will then import the diagnostic scan that was just taken into the software planning system. And it'll look such as this. This is your what we call an axial view. And this is called a coronal view. And then you have your AP, what we will discuss in a minute, DRR, and a right lateral DRR. And this right here, the green spot that you see, is where the physician decided to localize isocenter that I spoke of earlier. The next step will be creating the radiation treatment plan, which we will do in the symmetry. This is a process that we will go through then once the patient has been simulated to create their whole brain irradiation treatment plan. First thing which we have already done is import the data set into the treatment planning system. The next step is to remove the couch, which you see me doing here with this red line. Be careful not to disclude any of this part right here, which is the immobilization device, just the treatment couch itself. Do that. Click yes that you want to remove the treatment couch. Next thing you're going to do is localize isocenter, which we saw, which was created downstairs in CT simulation. I've already labeled it here CT ISO, and I'm just going to copy from POI so then it'll localize, as you can see right here, to that point. This is a point about which the gantry is going to rotate, and the point at which the therapist will set up downstairs for the radiation treatment to ensure that the correct area is being treated. Once that's done, you'll create your dose grade, which you see right here in green. That is the area in which you're going to calculate. So make sure to include any area that you want to know dose to. Next thing you will do is create your what we call critical structures. In this case, it will be the lenses, right and left, and the whole brain. The whole brain you see there in orange, and the lenses you see right there in the aqua green and darker green color, along with the spinal cord, which is right here in green. Once that's done, you can then generate the field in which you want to treat the patient. For the purpose of whole brain irradiation, you're going to use right and left laterals, which I've already created. the left being green and the red being right. This can be displayed then in what we call a DRR, which you saw in CT simulation, which shows the patient's bony anatomy. In the case of this whole brain irradiation, we're going to use the brain contour that we created and put a 1 centimeter margin around it to define our field. These are MLC leaves which will help shape the treatment field itself. So we do that for the right. And we also make sure to avoid the lenses. To make sure you've done that with the margin that you've created, you can just turn them on in 3D, which you can see here, green and the lighter green. Then you copy and oppose the beam, and you'll have your left lateral. Once again with a 1 centimeter margin around the whole brain, making sure you avoid your right and left lens. Now you're ready to calculate. So to calculate, you go to dose. Then you compute here. It's going to tell you that you want to remove everything below the couch that you've created earlier. Just click yes and accept. And you compute both beams. You want dose to be uniform throughout. So to do so, you can just do a 50-50 weighting, 50% of the dose coming from the right and 50% of the dose coming from the left. For the case of whole brain irradiation, we're going to do a prescription of 30 gray. So 300 centigrade and 10 fractions. Once that's computed, you can turn your isodose distribution on. Red will be your 30 gray, your dose you're prescribing to the patient. 98%, which is green. 95%, which is yellow. And if you wanted to see some lower lines, you could do 90% in purple, 70% in blue, and 50% in orange. We want to make sure that this whole brain, the orange structure, is at least getting 95% of the dose. I'll make that line a little thicker so that way you can see how it's encompassing all the brain tissue. So by scrolling through what we call the axial view, you can see that that orange structure there is encompassed by the at least 95% dose. Another way to determine whether or not you're giving adequate dose to the structure is to look at what we call the dose volume histogram and turn that structure on. So using the absolute dose, you can see here 30 gray. And this is the percentage of volume of the structure that you've turned on. So 30 gray is at about 98%. So you're delivering 30 gray to 95% of the brain tissue. If you wanted to see the dose to those other structures that you've created, just simply turn those on in the DVH. You can see the maximum dose to the left lens is 2.9 gray. The maximum dose to the right lens is 4.3 gray, which is good because the normal structures all have dose tolerances. In the case of the lenses, a particular dose tolerance you do not want to exceed is 10 gray. So once you've gotten the adequate coverage that you want for your treatment area, you can then export all your data to the record and verify system for treatment. And this is an example of a radiation treatment room where the patient will commence their radiation treatment. A couple of points to point out is that this table itself is flat, also made of carbon fiber as it was in the CT simulation. We also have the mobilization devices that we use for the course of a radiation whole brain treatment, which are the back bag and the mask that was created. For a course of whole brain irradiation, we use opposed lateral beams, one from the right side and then one from the left. The point about which the gantry itself will rotate is 100 centimeters at a point in space to the isocenter, which was made in CT, as you can see here. One anterior and a couple of lateral, just to make sure you're centered with the patient straight. The gantry itself will treat one lateral field for so many monitor units as was described in the radiation treatment plan. The gantry will then rotate to the other side and deliver the remaining monitor units, and that will be the course of treatment for that particular day. The patient will come back 10 consecutive days to complete the radiation treatment to a total of 30 frames.